we are going to spin the big wheel of birth today and see what topic is up. You guys ready to spin the wheel? Let's do it. Okay. Oh, glad I have my props close by because today we are talking about BREECH. So BREECH is the position of the baby when the baby is presenting with either their bottom or their feet first. So the way that the most effective and way for a baby to be born is head down. And let me grab my pelvis as we talk about this. So the baby is really designed to work head down. So, enter the pelvis, make its way through the pelvis. We have a great video on the pelvis, and when we talk about dilation and effacement and everything, it's really the best, ideal is for baby to present head down. But that doesn't always happen. Sometimes babies will present with their bottom down, like this. So breech with their legs up, or actually come through the pelvis with their feet that way. Okay, so that is breech. Now, when you are pregnant, babies move around. They're mostly in this fetal position, but they can turn around in your uterus and change positions, which is totally normal. But right around that third trimester, the 30 weeks or so, they generally tend to do less of those big flip motions because there's less room in there and sometimes less amniotic fluid in there for them to have the ability to make the big movements. So, and as the pregnant person, a lot of times it's hard to figure out what is going on in there. You might feel like they're kind of hitting you from both sides, or hitting you with their feet and hands at the same time, and sometimes it feels like that. But sometimes, and oftentimes, if we have providers that are hands-on, who do more of the feeling of our belly, trying to figure out whether our baby is head down position or in a breech position, we might know a little bit earlier on their position. And the main takeaway really from breech is that the sooner that you have an idea of whether your baby is in a breech position or not, the better. And the reason for this is some of our options that we have for turning a baby who is breech to head down vertex. The sooner that we know that, sooner we know that we need to work on turning a baby, or if we want to try to turn our baby, encourage turning the baby, the sooner the better, really. It's very hard at a 39-week appointment, a 38-week appointment to find out that baby is breech, and then try some of these techniques that I'll talk about in just a little bit. So I always like to encourage my doula clients and childbirth ed clients to ask when they're at their appointment, is the baby head down? How do you know? Can you show me? What does it feel like? And that really helps encourage our providers to share that information with us and check themselves. And the reason we care is that in most places at North America at least, babies who present breech, who are in the breech position in that last month of pregnancy, that 36, 37, 38 weeks of pregnancy, usually if they're presenting breech, oftentimes our care providers are scheduling a cesarean birth. So baby can no longer be born vaginally. Now, there are some providers around the U.S., rest of North America, that will do a breech delivery depending upon how the baby is presenting. And in certain cases, they will be able to offer a vaginal breech, which sometimes families feel like that's a good option for them, and sometimes it isn't. But if we know that our baby is in a breech position sooner rather than later in the pregnancy, there are a few things that can be done to encourage that rotation. I'm going to put some links below because I can't cover in depth in this wheel video some of the ideas about turning breech, and there's resources out there that are much better than what I'm going to be providing you right here, but I want to list a couple of them. One of them is called moxibustion, and that is done usually at an acupuncturist, and it is a technique where there is the acupuncturist can encourage the rotation of the baby. I'm going to give some more links below so that you can find out some more. There's also some positionings that we can do to encourage rotation of the baby. There are Spinning Babies is a great website that I like to refer my clients to for if they have a breech baby. They can do some inversions, which encourages turning. Something that I don't need to add a link for, but it's something kind of basic, is putting some cold, like a cold frozen pea bag on your belly to encourage baby to move away from the cold, and maybe having like a warm washcloth on the other side of your belly or a heating pad to encourage the baby to move away from the cold and towards the heat. Kind of simple, like low-tech techniques, but have been shown sometimes to move a breech baby. Now, sometimes we have babies that are persistent breech, that no matter what techniques and tips and things we try to encourage, baby will be, it's just, there's no turning a baby that's breech. So baby will be born generally via C-section. And what's interesting is that sometimes our breech babies, after they arrive earthside, is they will have their legs kind of up near their face, just even when they're laying in the bed. It's really, they're really used to that position. So the big takeaway I like to make sure that my students have with breech is knowing your fetal position as soon as you can, and and then you can check on these techniques. So if you're newly pregnant, you're watching this video, I wouldn't research all of the breech turning techniques right now, but remember to ask your healthcare provider at your visits if they can give you more insight into which way the baby is turned, and check out below for links to more information on encouraging a breech baby to turn. So thanks so much for hanging out with me today and talking about the breech baby. Vertex, breech, baby, or like this, breech. And we will spin the wheel again tomorrow. Again, check the link above for all the other videos prior to this, and I'll see you guys again next time.